What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, September 7th, 2023. Starting off today, we do have two news stories that came out just as I was getting ready to record this update. First Lady Jill Biden has tested negative for COVID-19 and is feeling better, the White House says. However, as you all know, she took Paxlovid, so we're going to have to watch this. We're going to have to monitor to see if she ends up having a rebound case like her husband, President Joe Biden, did last year when he had COVID. Also, there was this that just came in, this headline. Spanish Prime Minister Pedro Sanchez has tested positive for COVID and will not go to the G20 summit. As we know, there have been increasing cases around the world, and that includes famous people who continue to test positive. All right, moving on to this, we're just going to read a headline here. There's a couple things in the article that I didn't like to see. I don't like the headline either. It's not a good headline. New Jersey Veterans Home, where 200 died from COVID, still put residents at high risk, feds say. I mean, come on. It's 2023. The pandemic started in 2020. At this point in the game, we should be keeping our seniors, we should be keeping them safe. And yet we have an article like this that says they're not keeping them safe, and if you go on down here, it's in here somewhere. I'm not going to bother looking for it. They actually use a phrase I do not like. They go, quote, during the pandemic. No, it's not during the pandemic. Look at the GIF, or look at the graphic, the thumbnail that I use on my update video every day. I put, the pandemic is not over, exclamation point, exclamation point. And it's true. The pandemic is not over. Right now, this is the biggest wave we've seen in quite some time. So, I mean, no, it's not over yet. All right, moving on to this. Comes from Campus Echo Online, which says, serving North Carolina Central University since 1927. Then we come down to this. COVID outbreak arrives at NCCU, which again stands for North Carolina Central University. So they are seeing an increase in COVID cases at this university in North Carolina. We've seen a lot of different school settings have COVID outbreaks. Here's another one. Santa Paula High School cancels football game due to COVID outbreak. I believe this is in California. Yes, it's saying CBS Los Angeles. So yes, this one has been canceled. I believe they have had about a dozen or so cases with this. So, yep, they are dealing with a COVID outbreak. It also says that Santa Paula High School, who was set to face off against Le Canada High School on Friday, has instead opted to forgo the contest due to the rapidly spreading sickness, which has thus far resulted in 20 positive cases. Okay, so it's not 12. There was something here about 12, but now it's up to 20 cases within the football team and cheerleading teams. Wow. So that is not good. Ottawa area hospitals retightening masking requirements with COVID-19 case counts rising. So, yep, they're having to go back to masks because, hey, cases are going up. On Wednesday, Ottawa Public Health reported 8 additional Ottawa residents had died of COVID-19 over the past week, and 163 new cases had been confirmed. Moving on to this. Bruce Springsteen concert at JMA Dome in Syracuse canceled. Will be rescheduled. And we do know what his illness is. A representative for Live Nation said the singer is being treated for symptoms of peptic ulcer disease, and his medical advisors decided he should postpone the upcoming shows on his tour. So he has postponed shows for quite some time now. Moving on to this. This has to do with Scotland. Scotland is seeing quite a large increase in wastewater detection of coronavirus this week. Highest it's been for a year. And look at this on the chart. You can see here. Wow. It is literally just rapidly going up at this time. Not good to see. Let's take a look at air quality values. They're not all that good because, well, in the east it is just extremely hot. You can see here we do have a lot of orange here that's starting to fill in along the I-95 corridor. That's not good. These yellows, I mean, that's slightly bad. It could be worse. It's not terrible, but any of these oranges are not good. Then you come to the central states, and look at this. You have all of this red here, which that is bad air quality as well. The saving grace is the Great Lakes are not that bad. The Four Corners region's not that bad. Wyoming, Montana, western Montana, you do have a couple bad spots, as do you on the west coast, but mixed in between, we do see a lot of green, which is not terrible. Now moving on to this, taking a look here at the BA 2.86 variant tracker, and you can see here, there's now 102 cases of the BA 2.6. United States has 7, Denmark has 12, South Africa has 14, United Kingdom has 36. All right, taking a look at our heat-related illness map, and you can see in the south and western portions of the Great Lakes, in the Midwest through to Texas, all these brown counties are seeing much higher than average number of heat-related illness ambulance calls. We expect the Mid-Atlantic on the next update will probably be slightly up because it is really hot in the Mid-Atlantic right now. Alrighty, if you want to learn more about climate and weather, anything related to climate and weather, I do have another channel for that. Right now we are tracking Hurricane Lee. It's quickly becoming a major hurricane, and yes, the East Coast really needs to pay attention. Some data has shifted west. Check out that channel for more information. I'm going to have an update there this evening at some point. Alright, now let's take a look at Chicago. Did we get Chicago's update for this week? Last I checked, we did not, but let's see. Maybe it came in now. And yes, the average number of hospitalizations, they are starting to go up. Hospital beds in use are starting to go up. Emergency room visits looks like they're down ever so slightly. Laboratory confirmed cases daily average is now up to 158. That's higher than 154 from last week. Deaths, they're starting to go up a little bit. And vaccinations administered, not enough people doing that. That's dropped a little bit as well. Maybe we can hope that people are waiting for the booster to come out. All right. There was also this, speaking of vaccines. Mpox vaccine reduces severity of disease, study confirmed. So this is some good news. We're just reading the headline here, and let's see what else. We know Walgreens this week, the national positivity was 40.9%. The prior week was 43.6%. That's a difference of down 2.7%. And we do know testing was up this week. Now, we missed a few states throughout the week. I don't think we're going to go through them. I mean, some people have made the case that, how accurate is Walgreens data? Well, it's good to get a sense of what's going on, but just don't write home. And they're right. Don't take it literally, because sometimes what a state reports, what Wastewater shows, and what Walgreens show, you get three different things. It can get rather confusing, but I think we did do the most important states. We did miss a couple states, but there is some other things that I need to show you today, like this, which I showed you yesterday. If you did not see yesterday's video, here you go. The BioBot Analytics did do a correction, and they did correct higher for the South and the Northeast. The Midwest continues to rise, as does the West Coast. Here we are with the latest variants that are ongoing in the United States. I'm going to move myself left here for a little bit. EG.5 is at 21.5%. FL 1.5.1 is at 14.5%. Then you have a whole slew of other variants. There's literally probably somewhere around 25 variants or so. HV.1 bears watching because that's at 5.1%. It was nothing on the previous update. GE.1 is at 1.6%. I think that also entered a picture on this recent update as well. Then we take a look at COVID wastewater surveillance around the country, and you can just see here that there's a lot of red and orange on here, and that is not good to see. In fact, there are 104 sites that are at 80 to 100% COVID. There are 60 to 79 sites that are at 295 COVID. Moderate, really moderate to high COVID. There's 295 that are at 60 to 79%, so that's not good either. Then moving on to this, I think we did get an update here, and the majority of the country is either stable, rising, or seeing a significant, substantial increase in emergency department visits at this time. North Dakota and Arizona is actually seeing a decrease at this time, as is Delaware. And then you have places like Minnesota, Missouri, Oklahoma, and Puerto Rico, which did not report for some reason. Current admissions the past week, 17,481. That's not a good number. The weekly number percent of COVID the emergency department visits is at 2.3%, and change in everything, emergency department visits from the prior week was 19.4%. All right, let's take a look at a couple of those wastewater scan sites that show other things and not just COVID. So there was an article that came out, I believe yesterday, I didn't add this in here, that states RSV is starting to rise in the South. So I thought today, let's take a look at Florida and see what's going on there. Well, here's Miami. COVID is rising. Influenza at this time, not an issue yet. RSV here, it's actually down right now. But, I mean, it was rising there for a little while, but now it is down. So that's some good news. HMPV, there was a little bump of that at the end of August. Mpox, not an issue. And norovirus is starting to rise, which is not good to see. Then we come over here. Let's stay in Florida. Let's do a few in Florida. We come here closer to Tampa, St. Petersburg. This is a newer site. You can see St. Petersburg is starting to rise for COVID. Influenza not detected. RSV dropped. HMPV not an issue. Mpox not an issue. And norovirus is slightly starting to rise at this time. Let's do one more site in Florida. We're looking for RSV here. I'm not seeing it in the wastewater. So, I mean, maybe people are not living in areas that are having it. I don't know. But, or maybe there's no wastewater sites in areas that are having it. I'm not sure. But take a look at this. Orlando, the overall trajectory is higher. So, Orlando is still rising for COVID. Influenza is not rising. There's no influenza yet, no RSV, no HMPV, no Mpox, and no norovirus issues at this time. To be fair, we just did 3 sites in Florida. Let's go somewhere else in the country. Let's go out to, I don't know. How about we come out here to Idaho? We haven't checked this in a while. Let's check Boise, Idaho. I think it's been a couple weeks since we checked here. Lander Street, Boise, Idaho. 108,000 population. And you can see it's a lot of up, down, but the overall trajectory is upward for COVID. Influenza, not detected yet. RSV, not being detected now. There was some RSV back in July. HMPV, not detected. Mpox, not being detected at this time. And norovirus is, on the recent update, rising a little bit, but the overall trajectory is lower. So that's good to see. Alrighty, moving on now. Let's take a look at Philadelphia for yesterday. And unfortunately, Philadelphia added another 800 and... Hang on, that's not yesterday. I know it is in the 800s, though. And we're coming down here. Wednesday, here we go. 849 EMS incidents, which honestly, that's not much lower than 863 from the day before. So this is not good to see. You got heat-related illness, but you also have, hey, COVID levels are up. So I question how much of this could also include COVID. Wow. Montgomery County right now, I haven't looked at this in like the last 45 minutes. They are seeing a mass rush of calls right now. 22 calls. And I think I just saw one here that said heat exhaustion. Yes, here's one right here that says heat exhaustion. We're seeing altered mental status quite a bit. Ooh, cardiac arrest, that's not good. Nausea, vomiting, general illness. Oh, there's just, wow, it's busy. What's going on in Chester County? And look at this. Chester County is also busy. They got cardiac arrest, respiratory difficulty, heart problems. It's a very busy afternoon between the heat, the general stuff, and even what's going on with COVID right now with all these people getting sick. Like, here you go. Exposure to heat and cold. We know it's likely to be heat. So, yeah, wow. I mean, it is 97 degrees here right now. So, yes, it's definitely cause for there to be calls. Then we come to this. This is not good. New Jersey continues to rise with hospitalizations. And in fact, I have to zoom this in a little bit. Today was just a substantial increase. 426 hospitalizations that I reported to you yesterday, unless they corrected that. Today is 475. 17 people on a ventilator. I mean, if there's any good news in this, look at that ventilator number. That did drop, but again, we have to question it. New Jersey has so many times before in the past corrected their numbers. Then we come down to ICUs, and I don't like this. The number of people in the ICU. Look at the overall trajectory here. it's really been going up. It's more than doubled since July. It's almost tripled at this rate. So this is not good whatsoever. In fact, yes, it has tripled since late July. Look at that, 13. Jeez, this is just not good. So what we are seeing right now in New Jersey is not good. Discharges, 56. But as hospitalizations go up, the volume of discharges increases, as does the volume of admissions. So, I mean, activity in New Jersey hospitals right now is really starting to pick up. Alrighty, I think we can move myself back to the right. New York State, which this does include reinfections. 2,209 people have tested positive. New York State hospital admissions. Taking a look at this here, and let's actually zoom this in. It's going to refresh on us. We'll get back to the admissions in a second. The hospitalizations, they're up again today. 1,395, 126 people in the ICU. It's likely that New York State, if not this week, probably next week, will go over 1,500 people in the hospital, which, I mean, again, it's lower than these other numbers, but the overall trend is up. At some point it will peak, it'll drop a little bit, then it will rise again. So we are continuing to watch this rise. And now taking a look at New York State admissions, and you can see here that rise. Some of this could be holiday lag, but overall the rise, it is going up faster. And you can see on the average on this orange, yellow, this goldish, we'll call it a gold line, it's going up faster. So that's not good. New York City, let's see what's going on there. And New York City at this time, yes, New York City is also having an increase in hospital admissions that is pretty significant. And let's take a look at their actual hospitalizations. They did drop ever so slightly today, so that's good. 621 people in the hospital and 66 people in the ICU. Alrighty, Texas, we know Texas was bad this week. 30,196 new cases. That was 3,001 higher than the previous week. And 3 deaths more than the previous week, 42 versus 39. The hospitalizations, they increased by 189 to 1,427. And the overall average, it's going up as well. That's not good. Now we come to some new data. Ohio, in this week's update, says 8,607 new cases. That's not good. Hospitalization change, 163. ICU admissions, 12. Deaths, they added 13 deaths. So, Ohio continues to go up, especially for cases and hospitalizations at this time. And speaking of rising, yes, Colorado continues to rise as well. And taking a look here, 2,110 new cases reported. And as we know, this number has been going up pretty steadily to significantly. A few weeks ago, it made a pretty big increase. It says new hospital admissions this week, plus 47. That's 192. Currently hospitalized, 115. That's up by 3. And let's see what else. Do we have deaths? I'm not seeing deaths on here, but you get the general idea here. Colorado continues to go up. All right, finally, let's do a little bit of an international update. Then we will end today's pandemic update. And I have to back this up because that was taking a look at the United States, which we actually can look at some United States data. Let's see here how this looks. I don't know how accurate this is. They have nothing for today, but let's take a look at yesterday. As we know, Georgia yesterday, they're saying 1,000 cases. 4 deaths. New Jersey, 882 cases, 3 new deaths. I don't know where they actually get this data from, but I'm assuming it's out there somewhere, or else they would not be reporting on it. Louisiana, 1,300 cases in one day for you. Wow, that's a lot of cases. Alrighty, let's take a look at, hold on here, Puerto Rico. Puerto Rico, 1,389 new cases, and they added another 8 deaths. That's not good. Alright, let's go back to the various different countries. Taking a look here, the various weekly trends, which we like to look at. And we can see here, South Korea down 80%, weekly deaths down 44%. Russia, cases now up 98%, deaths up 45%. Romania up 43%, deaths now up to 100%. New Zealand, cases down 26%, deaths down 10%. Australia down 69%, cases down 71%. Switzerland, cases up 8%. Mako, cases up 11%. Then we come down here to Hong Kong, which is still at a 40% increase in cases. Guatemala, cases down 30%, deaths down 50%. Poland, cases up 38%. And deaths 2 versus 1, that's 100% up. Bulgaria cases are up 8%. Alrighty, folks, that does it for today's pandemic update. We will have another pandemic update again tomorrow. Until I see you all again next time, stay safe, everyone. And if you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this video, by all means, share this with them. I'll see you all again next time, everyone. Thanks for watching.